Hello. Yes, exactly, you're right. I'm Dr. Eclipse. So, you're here for your eye exam, I suppose? Exactly. Okay, so then you're right in the right place at the right time. Good. Well, how are you feeling today? Okay. Okay. Oh, that's great. Good. And what about your eyesight? Can you tell me anything? How have you been feeling lately in that aspect? What about your eyes? Have you had any kind of ache or pain around your eyes? Right. And what about any changes in your eyesight? Any troubles? Anything that hadn't happened before? Oh, I see. Do you usually wear glasses or contact lenses? Okay. Yeah. No. I can totally get it. That's right. And when it comes to your vision, what do you think in general? How would you evaluate it for now? What do you think, for example, your vision acuity? Let's say on the scale from 1 to 10. Okay. What about colors? Have you ever been tested for color blindness? Yeah, I'm just asking some questions in advance, but of course we are gonna test all of it and we'll see. Yeah, I just want to know how you would evaluate your vision yourself, because sometimes when the patients come, they can say that they have noticed some changes and that they think they have some troubles with their seeing objects, items, and of course in this case it's not really that good. So but sometimes they can be also mistaken, so it happens that it seems to people that their vision, that there's something wrong with it, while in reality after we test it all it turns out just fine. So just in case. Okay, and I think that if you're ready we could start actually. Do you have any questions? You can ask me anything in the process. Please don't hesitate. There are no foolish questions in the process when it comes to your health, when it comes to your senses. So there is nothing embarrassing. So please don't hesitate to ask me or tell me something if you remember something else. Yeah, that's totally fine. I'm your doctor. So no need to be shy or once again. So there is nothing silly or embarrassing about that. Okay, good. Also, please don't be anxious. The tests we're gonna do, they are not super difficult, and if they're gonna be a little bit harder for you, so we'll be able to see what the problem is and then we'll be able to fix it, right? So it's better to diagnose and to fix it further than just living this way and not even knowing that your vision, that there had been something wrong with your vision. We have some cases when people live their whole life not even suspecting, guessing that there's something wrong with their eyesight, and then later when they get tested and they get glasses or contact lenses, they discover the whole new world. So from scratch, because it turns out that there are so many things they didn't really see in detail, and and stuff like that. So yeah, it's it's life, and anything can happen. So it's just important to be on the safe side and to do the checkups regularly, so which you actually do, as I can see. That's great. Okay, now if you're ready, I think we could start. So please look at my fingers. And just follow them with your eyes, but with your eyes only. Don't move your head, please. Just keep it that way. And trace my hand, my fingers, with your eyes only. Good. Okay. Good job. Alright. Now let's try the same thing with the light. Before you start following the light, I will just check your pupil reaction if you don't mind. So I will bring the light closer to your eyes. I know it's a little bit unpleasant, but that's how I will see how your pupils react to it, yeah? So they're supposed to shrink in size when there's suddenly a lot more light, and then after it's gone they go back to normal. Okay, now to the other one. Okay, good. Now let me have a look at the reaction of the other eye. So when I put the light close to one of your eyes, and how the other one reacts to it. Okay, great. Now please look up for me. Okay. Now look down. Look to the left and to the right. Okay, perfect. Can you see me well now? Okay, good. Now please follow the light with your eyes only. Once again, no need to move your head. Okay. Good. Now please look at my nose and tell me if the light is relatively close to you or if it's like far from you. But please don't look at the light directly. Try to concentrate on my face and my nose, for example. Yeah, it will be maybe a bit easier to do it this way. Okay, good. Wonderful, great. Now let's keep on testing your peripheral vision a little bit. Keep on looking at my nose, please, and let me know which side the light comes from. The top, the bottom, left or right. Good. 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 Right. Okay, wonderful. Now please try to count how many times it appears and disappears somewhere in your vision, but don't look at it directly, look at me. Okay, wonderful. Three times. Four times. Okay. Four times again. Okay, wonderful. Good. So now, please tell me when you see my fingers wiggle on either side. But once again, don't look directly at my fingers, just look at my nose. Good. Wonderful. Now, please tell me when my fingers appear in your field of vision. Wonderful. Okay, that's great. Now, please tell me, can you see any difference between these two lights? Maybe in color, maybe in size, maybe like whatever. Okay, so this one is kind of warmer, more yellowish light, and this one is like white, classical, cold light. Okay, please follow the warm light for me. Okay, good. Good job. Now look at my nose and tell me which one is closer to you. Okay, wonderful, good. Now please look at my nose and tell me which one appears in your field of vision. Are you sure that it was one? Good. Okay. Good. Okay, great. Now please, what can you see here? Can you see this circle? Wonderful. Please let me know when the light is within the circle, okay? Good. Okay, and now once again. Good. Okay. Great. Wonderful. Once again, just tell me when the light is within the circle. Don't look at the light directly. Okay, wonderful. How many circles can you see now? And now? And once again? Okay, great. Now please look at my nose, okay? Now you can see one circle with your side vision. Okay, please tell me when you can see two, okay? Okay, good. And now please look in the center of these two circles, and once again, let me know when you can see two of them, okay? Good. Once again. Good. Once again. Good. Wonderful. Now. Wonderful. Good. Okay. Okay. Okay, great. You're doing good. Now, I will close one of your eyes and you will tell me when the light appears in your vision. Yep, so there is nothing really complicated about that. By the way, please tell me, what color is this light? Okay, great. So, please, look at it. Okay, wonderful. Now please tell me when it disappears from your vision. Right. Fine. Now the same thing with the other eye. Is this light the same color as before? No, it's green. Okay. Just follow it with your eye. Now please tell me when it leaves your vision. Okay. Right. Thank you. Now, let's test your vision acuity. As you know, probably you are already familiar with this tool. It's called Snellen chart. So it is used to actually define the visual acuity, so your vision acuity, the acuity of your sight, so how detailed, how precisely you can see everything around you. Okay, please tell me, what do you think is the lowest to the smallest line that you can still read, like whole, without any trouble? Let's read it. Okay. Good. Okay, good. What about the one that is lower? Right beneath it. So please read the one that is under the previous. Let's give it a try. It's alright if you make mistakes with some letters. Well, basically, if you make 2 mistakes in this other line, it means that the previous one is actually your acuity level, which you were right with it. Okay, great. Now please tell me, what color is this? And what about this second line? Good. And this one? And finally the last. Okay, great. Good. So that would be for the Snellen chart, and then I have some more charts for you, actually. So here we have another Snellen chart, a little bit different. Right. There's also one right behind me. But it's way too far, so we're not gonna proceed with that one for today, please. Maybe some other time. Okay. So I have some Ishihara tests for you. Can you see anything here on this sheet of paper? Right, what can you see in the first place? Tell me, please. Okay. Okay, good. So now please tell me, what can you see in this first circle? Okay. Are you sure about that number? Okay, now that's good. Okay, now what about this one? That's how we're gonna test if you're colorblind or not. Now, you already mentioned some colors on this previous Snellen chart, which is great. But now let's test your color vision in more detail. Okay, so this would be 8. Okay, what about this one? Okay, now this row. Okay. And what about this? Okay, and this one. Got it. Great. Now I will show you some more ones, some other ones, but they are not so contrasting. The colors are not as bright and as saturated as in the previous one, right? You can see it. so it might be a little bit more challenging for you. I'll bring it a bit closer if you don't mind. Okay, isn't better now? So what about this one? And this. And about this one. Good job. Now into this. Now this circle. Great. In here. Almost. Right. Good. Well, you do really well. Now I have some more cards to test both your color vision and like some other aspects of your vision and maybe your focus a little bit too. So please tell me if you can see anything here in this square on this card. Is there anything hidden? Maybe some symbol, maybe some letters, some numbers, some shape, figure, whatever. There can be anything. Okay, letter X. Good. Now to this one. Is there anything in here? It might be a little bit more challenging, but I still think that you can handle it for some reason. Is there anything hidden in this one? Some circle like letter O. Right, sure, it's a little bit darker, right? Okay, good. Now I'll show you some more ones. Oh, there is no hurry. It's alright. It's totally fine. Just give me a moment. Okay. So what about this one? I'll bring it closer to you. Anything? Letter W. And this way? Letter M. Okay. Now, about this one. Can you see any letters hidden there? Maybe not letters, maybe something else. There's letter L. Good. And what about this one? It's pretty similar in color to the previous card. Can you see anything? No. Well, actually, you're not supposed to. So it's kind of all homogeneous, all empty. This one. Is there anything? Letter P. Good job. And this one. Are you sure? Okay, there's nothing inside. About this. Yeah, actually there is nothing inside again. And on this one. Okay, good. Now what about this? Can you see something? What is it? Does it look like some kind of a snake or letter S but tilted to the side? Ooh, so accurate. Good. Okay. And what about this one? Try again. I'll bring it closer. Oh, okay. Again, some like curvy lines, so like letter S, but a bit more. Okay. And here, letter E. Okay. And now here, pretty similar colors. Is there anything you would recognize? No, nothing at all. Right. What can you see here in this picture? How many cats can you see there? Ooh, are you sure? What colors are they? How many pumpkins can you see? Try again. No, okay, good. Okay, tricky. Fine, right. What can you see in this card? Please tell me. Triangle. Is it homogeneous in color? Are there any shades of colors, or is it all exactly the same? And like, how many shades can you see? 3. Right, okay, no, not bad. And what about this diamond? How many colors can you see here inside it? 2 main shades, yeah? Lighter green and the darker one. Okay. Okay, wonderful. Oh, you're doing great, like I said. That's totally fine. Okay. Now, please, have a look. Let's test your focus a little bit. How many cards can you see here? Let's look at them. You know? Wonderful. Okay. So, which one is missing? What color was it? Okay. Which one is missing now? Okay, blue. What shape? Diamonds. Great. Which color is missing now? Color and shape. Like, if you remember both, that would be amazing. Kind of like purple, magenta, square. Okay. What about now? Yellow circle. Here it is. Right here. Wonderful. Okay. Now I'll just show you some colorful cards. So let's try these. Okay. How many colors can you see here? Okay, good. Which one is missing now? Okay, great. What about now? Which one is missing? That's right. Now let's try once again. Okay. Also, how many colors can you see here? Are you sure? Now what if I drop this green one? These 2, are they exactly the same color, the same shade of yellow? I'll bring them a little bit closer to you. Can you see any difference between them? There is a slight difference. Which one is lighter? This. Good. Right here. Now, please tell me once again, how many colors can you see here? So pink and green, just 2 colors. What about now? These 2 cards, are they the same color, the same shade of pink? In this way, are they still seen to you? Like that. So there is a slight difference between them. Okay, great. You're doing really well. Okay, wonderful. Well, you're definitely not colorblind, which is great, I think. Then your peripheral vision, your peripheral sight is totally fine too. You could see all the items in your field of vision even when you were actually concentrated on my nose, right? So that's really cool. Now your vision acuity is totally fine as well. Seems like all the cranial nerves related to your eyes, to your eyesight, are working just fine too. So I guess there's nothing we should worry about. What do you think? How are you feeling currently? How are you feeling right now? Do you have any questions to me? Okay, so which tests seem to be the hardest for you? Okay, all right. Well, usually our patients find them really, really fun and relaxing and also entertaining at the same time. So I hope that you really enjoyed all of them. Yeah, you can let us know which one you enjoyed most of all. And then, like the next time, we will have some other tests. Yeah, so we can alter them from time to time. So for our patients not to get bored and also to be able to actually test your eyesight from different perspectives, yeah, from like in different aspects. So yeah, and that will be it, I guess. Okay, let me type in some of the results, and please let me know if you still have some questions. Yeah, so you can think about it, okay, while I'm putting in all the results and the conclusions. So you did really, really great. I told you there was nothing to worry about, like literally just nothing at all. Okay, good. Right, there we go. Okay, good. Well, so I guess that in this case, if we're done, if you're feeling good, I can let you go. Well, would you like anything, like a glass of water? Do you feel like is it all right? Are you sure? Maybe you'd like to get some rest after these exams, so you can just stay here. Yeah, another patient is gonna be like in some time, not right away after you. So yeah, you can definitely even like take a nap. Sure. Okay. Then I'll be back soon. Okay? Great. See you soon. Alright, could you please follow my finger? Good. Good job. Okay, don't get distracted, please. Concentrate. Good. Fine. Now please concentrate on my nose and tell me if my finger is relatively close to you or relatively far from you, okay? Good. But please keep on looking at my nose. Okay, wonderful. Good job. Well now, could you please follow the light for me? Just with your eyes only, don't move your head, please. Okay, great. Good job. Okay, now let me test your peripheral vision. Just concentrate on my nose and tell me which side the light comes from, okay? Good, wonderful. Okay, amazing. And great. And what about now? And what about now? Good. What about now once again? And once again. Okay, great. Okay, now please concentrate on my nose or on my face, wherever you like better, and just let me know when the light appears in your vision, okay? Good. Okay, no need to specify the direction, doesn't matter that much. Now let me know, okay, how many times it appears and disappears. Okay, that was 3, great. Yep. Okay, 3 again. What about now? Good job, just twice. And what about now? Okay, great, 3 times again. Wow. Good, now concentrate on my face, please, and let me know if the light is close to you or relatively further from you, okay? Good. Wonderful. Okay, good job. Okay, great. Good, you're doing great. so far. Well, now is it close to you? Okay, now let's check your pupil reaction to the light. Okay, it will appear and disappear, and I only need to have a look at how your pupils react to the light. Okay, good job. And now the other one. Good. Okay, now the other one. Oh, wonderful. Okay, amazing. Well, so far so good. Okay. Now, please, okay, let me know when you can see the light, okay? But I will close one of your eyes. Okay, good job. Is it blurry or can you still see everything in detail? A bit blurry. Okay, let's try with this one. What about now? So you can see the details. It's not blurry. Okay, well, let me check that eye once again. What about now? Can you see everything? Okay, so it's not that blurry anymore. Alright, well, let me check that eye a little bit closer once again. Can I have a closer look at it? Got this. Could you please look up? Okay, wonderful. And look down. Good. Now with the other one, look up. Okay, and look down. Wow, good. Fine. Okay. Now concentrate on my nose, okay? And just let me know when the light starts flashing, okay? Good. Good job. Okay. Now just once again, the same thing. Just let me know when you could see the light flashing. Okay. Good. I won't overwhelm you with these flashing lights, just turn a little bit to see if you can react to this change. Well, obviously you can. Okay. Now could you please look in the center? Keep on looking in the center. Please concentrate. Good job. Okay. Okay, what can you see? How many circles can you see now? Okay, but now, what about now? Okay, wonderful, good. Right, now, let's test your eyes a little bit more in some more detail. Could you please tell me what color is this? Are you sure? Okay, what about this one? Okay, amazing. This, like approximate shade would work. Okay. Wonderful. Okay. Okay. Great, so you're not colorblind, which is great. Now, could you please tell me how many colors can you see here? Okay. Are you sure that these two are different colors? Good. And now, once again, how many colors can you see? Okay. And now please tell me what colors did you see there? Just want to test your concentration level a little bit. Yeah. Alright. So how many cards have you seen once again? Good. Was there this one? No. What about this one? Okay. Okay, great. Good. And now, would you please have a closer look at these cards? How many colors can you see there? Just 4 of them. Okay, fine. And now, could you tell me what colors have you seen? Okay. Right. Good. Good. Yes, you're right. Absolutely. Okay, and are these two like different colors? Okay. Are they similar? In what way are they similar? What about these two? Okay, wonderful. Great. And now, out of those four, which one is missing? Do you remember? Okay. And what about now? Which one is missing? Good. You are doing just great so far. Well, that's amazing. Now, could you please tell me if these four cards are all different shapes? Okay. What shapes have you seen? Can you recall that? Can you remember? Right. Good. And what color was this circle once again, if you remember? Like that. Good job. And have you seen any triangles there? Could you be more specific? What color was that, if you remember? It's fine if you don't, because it was very short time that you could see them, so it's just fine. No worries about that. Okay, like that. Okay, good. And what other like two shapes? So we have talked about this circle and about this triangle. Do you remember two other cards? Okay. At least the shape or the color doesn't matter. Okay, that will do. Fine. And now I will show you just three of them. Okay. And you will let me which one is missing, like maybe the color or the shape. If you remember both, that will be like perfect. But it's fine if you don't. Once again, this one. Okay, good. You're doing great. I mean, seriously. So your attention span seems to be fine, just fine. Right, now let's test your ability to focus in a little bit more detail. So I have three markers, okay? Could you tell me what color is this? What about this one and this? Good job. Okay, now please follow the yellow marker for me. Okay, now please don't get distracted. Follow the yellow one. Yes, good. With your eyes only. Please try not to move your head too much. Okay, good job. Wonderful. Okay, and now once again, which three markers have I shown you? Which of them? What colors were these? What colors were they? Once again, it's cool if you remember. It's also fine if you don't, so it's not a big deal. Okay, yellow, orange, and something like purplish. Okay, right, yeah, good job. Okay, amazing. And now could you please tell me, this might be a bit more challenging, but I'm not sure. So, are these two exactly the same shade of yellow? Or can you see any difference between them? Okay. Are you sure? Let's try once again. Good job. You're doing amazing. And now what about these two colors? Can you see the difference? What color is this? Okay, great. Could you follow the green one for me? And now please tell me which two colors have you just seen? Okay, good. Yes, you're right. Okay, wonderful. And now I will close one of your eyes and just please keep on following this marker for me. Now please let me know when it disappears from your field of vision, okay? Okay, good. Fine. And now with the other eye, the same thing. Just keep on following it with your eye. And now just tell me when it disappears from your vision, okay? Awesome. Good. Okay. Amazing. You're doing great, as I said. Okay, fine. Now please tell me, can you see any difference between these two kinds of lights in color, in shade, in size, and so on? Okay. Could you please follow this big cold light for me? Just for a moment. Now let me know when this yellowish warm light disappears from your vision. Good job. Good. Okay, you're paying attention. Wonderful. No? Alright. Awesome. Great. Now, please let me have another look at your eyes. And okay, great. And this side, just give it touch you once again. This area around your eyes. And now once again. Okay, great. Everything looks just fine. Well, now your eye exam. I know it's kinda weird to have an eye exam without opening your eyes, right? But I'm sure we'll make it work. So let me take some stuff I'm gonna use for that. 1 second. Well, here I am. So keep your eyes closed, please, and simply let me know when you can feel the light somewhere in your field of vision. Okay. So it must be quite easy, quite doable. Okay. Just relax. It will be quite close to your face, so you will be, most probably you will be able to feel it. Well, ready? Okay, great. Now once again, just let me know when it appears in your vision, kinda, when you can feel it. Right, you are. Alright. Good job. Once again. Okay, great. Good. Now, once again, you can keep your eyes closed, but I'd like you to let me know what side, which direction the light is moving from, okay? It can be either bottom or from the top, and like right or left, obviously. Okay, good. Let's do it. Right, you are. What about now? The same side. Good job. And now the bottom again. Okay, great. Okay, amazing. And now once again. Right, you are. Good. Okay. Wonderful. And what about now? Good job. Wow. You're doing so good so far. Okay, now let's make it a little bit more challenging for you, right? So I'll do the same kind of stuff, but you will have to count how many times the light has been on and off, okay? Regarding your field of vision. So just how many times it appears and disappears, okay? So good. Keep your eyes closed, please, and let me know if the temperature of the light has changed, maybe like the shade of color, or like how warm or cold it is, if you can feel any difference. But just let's give it a try. I will just flash it in front of your eyes a little bit so that you can feel if there is any difference or no. So, okay. Yeah. Wonderful. So this light is kind of like warmer. Now please keep your eyes closed and let me know which kind of light is in your frame of vision. The cold or the warm one, okay? Once again, I will bring it quite close to you so you'll be able to feel the difference, I promise. Okay. So what kind of light was that? Okay, good. What about now? Yes, right, it was a white cold light. What about now once again? Okay, it was the warmer one. And now, what kind of light was it? The warm ones again, okay. And what does this feel like? Is it cold or warm? It's cold. Good job. And now, well, wonderful. So you can feel it perfectly well now. I'd like to make it once again a bit more challenging for you. So what you need to do is to let me know what kind of light it is, and also which side it comes from, like which direction. Okay, great. Once again, keep your eyes closed, please. Yeah, no cheating. You need to relax. Believe me, yeah, you can trust me on that. So I know what you need. So and to relax really well, you need to close your eyes, okay? And yeah, this cranial nerve example will still be quite accurate, I promise. Good. Okay. Okay, it was warm light. Alright, John, and what about now? Good. And now. Amazing. What about now? Okay, that's a great result. Once again. Good. Okay, wonderful. Great. And once again. Good job. Wow. You're doing so good. Well, now, please let me know if the line that I'm tracing with the light is vertical or horizontal, okay? So, no need to concentrate on the side, the direction of the line, just if it's vertical or horizontal, okay? So, it must be easy. Let's check. I'll trace it a few times so that you have time to concentrate and understand what's going on. So, what would you say? What would be your verdict on that? Okay. Yep. Right, you are. And what about
was that? Horizontal, good job. And now, still the same one, good. And what about now? Great, you're doing so good. Well, now you can keep your eyes closed. Please let me know what the color of light it is. Once again, I'll put it quite close to you so that you can feel it, you can differentiate. Okay, it was red light, great. And now, once again, good, the same kind of red light. And what about now? What kind of light is that? What color does it feel like? Green one. Alright. Now I'd like you to tell me which color of light can you feel, can you see on the right side, okay? On the right. For you. Okay. Good. And now please let me know which kind of light, which color you can feel on the left side, okay? The same one. Yep, so I switched them. So now, yeah, the one that was on the right is on the left now. Good job. Okay. And now just let me know which light is in your field of vision, the red or the green one. Please keep your eyes closed. The green one, okay, good. What about now? The red one. And now the red one again. And now the green light. And what about now? Good job. And now, well, wonderful. Great, you're doing so good. I'm so proud of you. Well, now the hearing test, okay? I suppose that with your eye test, we can say that we are done, because I know that you are not colorblind. You can even feel the difference between the temperature in like the same shade of color. Yeah, like when it's either colder white or like warmer, like yellowish light. And you realize